I'm James Lloyd Wade III. I'm a medical oncologist hematologist, and I'm the president of Cancer Care Specialists of Illinois. I also teach at Northwestern University. I'm an associate professor of clinical medicine of the Feinberg School of Medicine of Northwestern University. Many years ago, when I was a medical student, and we would see a patient with a newly diagnosed advanced cancer, what struck me was the pessimism that my teachers expressed, and that the best we could do for those patients in their mind was to just help the patient be comfortable and accept that they would die of their disease. I found that, to me, not acceptable. And I changed my medical school curriculum and spent 2 months at the Johns Hopkins Oncology Center in Baltimore. And I was fortunate to spend time with giants in the field, a very early field of oncology at that time. People like Dr. Marty Abeloff, Dr. Hayden Brain, Dr. Rain Sorrell, who were pioneers in using these new drugs, chemotherapy drugs, to help fight cancer. And we're starting to recognize, back in 1977, early gains that we hadn't seen before in treating cancer. And I began to realize that there is hope if we can apply research and apply new science to solving this problem. We don't have to just accept cancer as a fatal diagnosis. We can push back and help patients do better. And I've taken that to heart ever since. So in coming to Decatur, we've been lucky to incorporate research in everything we do. And by applying new treatments through carefully implemented treatment programs, we call these clinical trials, we've been able to make major inroads in improving the outcomes for patients with many different kinds of cancer. And we've been able to help discover 3 drugs that can actually help prevent cancer. These have been major changes in my career, and I look at these as the beginning of turning this whole process back. We are by no means done. We have a lot of work yet to do, but it's gratifying to see the progress we've made in the last 32 years. We have a duty to care for each patient as an individual, recognize that that patient is part of a family, and they have needs when they're facing the crisis of a cancer illness. So we take all of the factors into consideration, that patient, their age, the specific characteristics of their cancer, to help develop a plan for that individual. We don't work for anyone else that has an agenda telling us what to do. We plan what we think is best for that individual patient, independent of what an insurance company might tell us, what a hospital might tell us, what a healthcare agency might tell us. And we'll fight back to make sure that we bring the best treatments available for that patient and their family to bear to help them fight their illness. So clinical trials are an organized way to answer tough cancer-related problems. We do these patient by patient, disease by disease, collect a huge amount of information. I'm the principal investigator of a regional cancer research program called the Heartland NCORE. The Heartland Cancer Research National Community Oncology Research Program is a competitive program that we applied for over 2 years ago, and we were one of 35 sites nationwide to be selected to do cancer research in the community. Our program extends from as far north as Galesburg, Illinois, to as far south as Cape Girardeau, Missouri. We touch patients in 5 states. We are the cancer research program for a community of more than 15,000 new cancer patients per year. We are one of the top 5 such programs in the United States. We've been recognized by the quality we provide. We've received 2 quality awards from the American Society of Clinical Oncology, what's called their COPI, Quality Oncology Improvement Initiative. We initially had our first COPE award in 2011 and were recertified last year. We're one of the only practices in central and southern Illinois to have such a designation. And it's, I think, a symbol for patients to be able to take to heart, to know that they're getting the very best cancer care when they come to us with their cancer-related problem. From the professional standpoint, I can look back at how we've been able to integrate research into clinical care and see patients doing better. And from the results of our research, not only can we help cure more patients with cancer, but we've been very important in the development of 3 drugs that can actually help prevent cancer. We were major participants in a study that demonstrated that finasteride could reduce the chance of a man getting prostate cancer by 25%. And we've been major participants in 2 research studies that demonstrated that tamoxifen and raloxifene can reduce the chance of a woman getting breast cancer by as much as 50%. And being able to not just treat the disease, but prevent the disease is a goal we're all striving for. And I'm very proud of that new knowledge that we helped develop.